Dear colleagues, it's my pleasure to give you this presentation in name of my co-authors, Schurch and Chapple. This is a study reporting about symptoms suggestive of urinary tract infection among intermittent urinary catheter users. This study is a UK study, a retrospective one, a real-world analysis of a longitudinal patient database. Let's see my conflict of interest. This study has been done under the promotion of Braun. As you are aware about it, we have low knowledge about the long-term follow-up of patients using self-catheters and also of patients using pre-lubricated or hydrophilic catheters. So the study was designed as an observational and retrospective study, and the data source was a longitudinal patient database compiled by GPs in UK. We targeted on adult patients using intermittent catheters, and the main objective was to compare the safety profile of pre-lubricated intermittent urinary catheters with hydrophilic one. And the parameters we used were the occurrence of at least one symptom suggestive of UTI over the exposure period and the number of symptoms suggestive of UTI per patient over the exposure period. The design of the study has been done between June 2016 and September 2019, and patients were scheduled to be followed at least 12 months. And for sure, an extended follow-up period was designed, and it ended in January 2020. The inclusion criteria and the population were adults, patients using intermittent urinary catheters during the inclusion period, patients with at least 1 year after index date and with at least one visit in the 4 months following the end of the follow-up. Definitively, major exclusion criteria was a prescription of 2 different types of catheters at index date. The main criteria we used was symptoms suggestive of UTI. Why? Because we are unable within such a registry to have a clear and relevant information about pure UTI and pure usage of antibiotics definitively against UTI. So what we are able to look for is a prescription of a non-specific antibiotic plus a diagnosis of interest regarding UTIs, and the prescription of a specific antibiotic regardless of the associated diagnosis. So that's why the main criteria of the study was SSUTI. And we at the analysis period, we had some interest for some subgroups like age groups and gender groups. The patient selection was made among 7,560 patients, and including all inclusion and exclusion criteria, we focus on 5,296 patients. And as you may see, a few patients, 458, were using pre-lubricated catheters, and a lot were using hydrophilic catheters. It was more than 4,000. So to have a good comparison between both type of patients using pre-lubricated or hydrophilic catheters, the method which was used is the application of the propensity score matching, the PSM, and at the end we are able to compare 2 comparable groups, pre-lubricated and hydrophilic catheter users, and each group was made of 458 patients. So the validity of the study is such a way very strong, and we have 2 comparable. The patient characteristic after the propensity score match at the index date was very good. As you may see, there was no difference regarding those patients regarding age, sex, BMI, diabetes, etiologies, and regions. Absolutely no significant differences between the groups at the index date, and a similar starting point for the 2 cohorts being compared in terms of number of patients with at least one SSUTI. What about the occurrence of at least one SSUTI over the exposure period? If we compare and if we analyze the overall match population, the the proportion of patients with at least one SSUTI was similar in the pre-lubricated and hydrophilic group. If you look for the continuous population, what is the continuous population? Is those patients who didn't change the type of catheter they are using during the study period. As you may see, it's 269 patients in the pre-lubricated group and 280 in the hydrophilic catheter. There is a significant difference between regarding the SSUTI, which is in favor of pre-lubricated. The number of SSUTI over the exposure period was different, statistically different between pre-lubricated and hydrophilic catheter group, and it was in favor of pre-lubricated. What about the number of SSUTI over the exposure period by gender? There was no difference for male, and there was a slight difference for female, which means that it was about 1 SSUTI over the exposure period for a pre-lubricated catheter female and 1.4 for hydrophilic catheter female. What about the number of SSUTI, the global number of SSUTI over the exposure period? The only subgroup where a statistically difference was found is a group of patients aged 18 to 50. And what about the number of SSUTI over the exposure period in the overall matched population? It was in favor of pre-lubricated cohort, which maintains their comparative advantage versus hydrophilic catheter. So the conclusion is that the occurrence of at least one SSUTI over the exposure period for overall matched population, it's a similar proportion of patients who experience at least one SSUTI. For the continuous population, those who never changed the catheter type within the study period, it was in favor of pre-lubricated catheter group. And definitively, the number of SSUTI over the exposure period was significantly fewer for patients in pre-lubricated group than hydrophilic group, and the same result for the subgroup of 18 to 50. So we hope this study will be able to give us some help for the long-term follow-up of patients using self-catheterization. I thank you very much.